So we've talked a bit about functional maneuvers for the nose. I think now we're going to sort of switch gears and talk a little bit about aesthetic rhinoplasty. And, nose reshaping is about form and function. So all of the things I've talked to you about have to be taken into consideration even when you're doing a rhinoplasty just for looks. You have to think about what you're doing to someone's nasal airway because you don't want your patient to be that person 20 years later who's asking someone to fix their nose because they can't breathe. So this is something we think about whenever we do surgery on the nose, even if it's just for looks. Thinking about rhinoplasty begs the question, what is the ideal nasal form? And these are just some images. Actually, some of these images are taken from emails to me from patients considering nasal surgery, saying they want their nose to look like this or that. Obviously, there's the ancient Egyptian ideal of the nasal form. People have actually tried to quantify what the ideal nasal form should be. This is actually a textbook which is by a couple of people who were at Stanford back in the late 70s, early 80s. And there are a few things that can be maybe taken from this. The idea that the nasal dorsum or bridge should form a nice, gentle curving line from the medial brow out to the nasal tip. Okay? The idea that the rotation of the nose, that's this angle here between the lip and the nose, the amount of upturnedness, so to speak, of the nose, should have an angle of about 95 to 115 degrees in women for the ideal feminine nose, and 90 to 95 degrees in men, so it should be more acute. Now, by the way, this varies inversely with height, so if you're taller, it should be less upturned. If you're shorter, it should be more upturned. Think about it in the sense that you wouldn't want to be looking up somebody's nose if they're very tall. And if they're shorter, they can get away with having the nose upturned a little bit more. So these are some of the ideals that are out there. That chin position affects the perceived size of the nose. The concavity or convexity of the facial shape can be affected by the nasal shape and the projection of the chin out here. So often in patients who have a, quote, large nose who want it to be smaller, if their chin is small, one of the things we evaluate them for is potentially augmenting the chin at the same time as reducing their nose. But really the take-home message from all of this in my practice is that there is no ideal nasal form. The numbers which I showed you before were by and large taken into consideration for the Caucasian female when they were calculated. But not everybody is a Caucasian female. The ideal nose will vary with ethnicity, with gender, with facial shape, with skin thickness, which can alter the shape of the nose and the face, and personal preference. So the bottom line for me is that there is no cookie-cutter rhinoplasty. And what looks good on one person may not look good on another. So everyone has to be evaluated individually. When evaluating a patient, of course you want to look at their overall health. We're talking about here now an elective procedure. So if somebody isn't healthy enough to undergo a surgical procedure, they really shouldn't be considering having something elective. How is the nasal airway? We just spent a lot of time talking about the function of the nose, and we want to preserve that. We certainly don't want to impinge on that in any way. Has there been prior surgery on the nose? Revision rhinoplasty is a much more complicated topic, and we'll touch on it a little bit later. And most importantly, what does the patient expect from the surgery? And what can I communicate with the patient about what they might expect physically from the surgery? What do they expect from it? And more importantly, what are they looking for emotionally from this? Is this something that they're expecting will change their life, save their job, or save their relationship? Because it's not going to do any of those things. It can have a profound effect emotionally on some folks, but it's not going to do any of those things that I just mentioned. I think that in evaluating and understanding what can happen physically for patients, computer imaging has really changed the game for me in my practice. And I think that this kind of demonstrates nicely. For me, the computer simulation part of the consultation is very important because it's actually an educational opportunity for me and for my patients. For me, it's an opportunity to kind of understand what it is that they're looking for and understand if it's something that I can achieve. And for them, it's an opportunity to see what things might look like and for me to educate them on what is possible. Certainly, I can do anything with the computer imaging program, but I try to keep it as realistic as possible so they understand what they might be getting themselves into and what things might look like. And this is just an example of a patient who wanted the bump to be taken down a bit and the tip to be turned up in a natural way, didn't want to look like she'd had a nose job or a rhinoplasty. And this is what we talked about in our computer simulations. And this is actually a very early result, just a few weeks after surgery. It's still a little swelling in there, but showing that even that soon after surgery, we have achieved something very close to what we talked about with our computer simulations. Just a quick word about the procedure. It's an outpatient procedure. It takes about 1.5 to 3 hours. There's a wide range there because of the complexity that may be different depending on the patient. It can take 3 or more hours in very complex cases or in revision rhinoplasty cases, which we'll talk about in just a little bit. This can be done under local anesthesia with sedation, but I recommend against that in virtually all cases. And I recommend a light general anesthetic, and we can talk about that more later if any of you have questions about that. After rhinoplasty, the nose is taped for 1 week. There's a piece of plastic, a so-called cast on there. Bruising can occur, depends on the patient. It can last 7 to 10 days. Generally, patients are very presentable after the 7 to 10 day time period, but final results can take a year. And why is that? I talked about this tent concept before, and again, the appearance of the nose is the result of a complex relationship between the skin envelope and the structural bony cartilaginous skeleton underneath. Very small changes in the interaction between these two can have profound effects on the shadowing of the nose and the way it looks. And this is not something that generally is noticeable to the casual observer, but it will be noticeable to the patient and to the physician, people who know what's going on. So a very small amount of swelling can exist and persist for up to a year, or even maybe a little bit more after surgery. And that's why in rhinoplasty we say final results take a year. Facial shape with skin thickness.